Yep, so we're on now, but we're going to just give folks a few minutes to join us.
Okay.
It usually takes a few minutes for people to show up. How was your day today, Frank?
Been busy. Been
Yeah.
busy. A lot of phone calls at the same time in Texas and stuff. So I see the restaurant from getting closed down today. So
That's which restaurant?
the one on Laramie and 31st, just the owner. It's a new owner. She didn't know how to file her paperwork, so I had to,
Mm.
make some phone calls and help her out. But they were going to shut her down today.
And you
So
stopped it. That's good stuff.
yeah, so I got her in, and she opened that she's operating right now. So she's like, "Phew," they would have shut her down at least a couple of weeks. But I go, well, we straighten it out. Yeah, it's a young lady. She bought the company about a month ago. No, 3 months ago. She's very young, so she didn't know
About
how
the
to file
paperwork.
paperwork. So
And what's the name of the restaurant? Let's give her a
uh,
plug.
Lagostinos.
Lagostino. What kind
On
of
Laramie and 31st Street.
okay. Is that seafood?
Yeah, great seafood.
Nice. Did you get us some free food out of the deal?
No,
Do we go
I went
we
yesterday.
gotta go for lunch or something?
We got to go there. I went yesterday to talk to her, kind of guiding what to do today in the morning. So I was there
Yeah,
right there yesterday.
yeah. And Mr. Rocha, how was your day today?
It's going good. I had a good day so far.
So I'm so glad you could join us. I know this is I know you've probably been at it since the wee hours of the morning, but um we like to get to the people at their convenience, and 6 p.m. works for a lot of folks. So I'm glad you could join us.
I'm happy to be here. Really excited for tonight. Look forward
Right.
to talking about some great things and then hopefully getting some good questions answered. And always happy to be here with you and the commissioner.
Oh, thanks.
Thank you.
That's great. We're going to have you back lots because you're the man of the hour. Do you have just a list of requests for your presence? I can imagine everybody wants to talk with you, I'm sure.
It's exciting. I feel very welcome.
That's good. I think and how it's unfortunate that you're here during COVID-19, but wait till summertime Chicago. You're gonna it's gonna be no better place. You're gonna wonder why you weren't here sooner. I promise.
I love it.
Yep. The more I travel, the more I like it here. And I love New York. I'm a huge fan of New York. Um, but Chicago is my kind of town.
And I'm excited, and this is going to sound terrible, but I'm really excited to eat my way through Chicago. I want to get to know it through my stomach.
They
I
got the
mean,
whole world here, Israel. They got the whole world.
Yeah.
Chinese food, Greek food, Mexican food, you name it.
yeah.
It's in Chicago.
There's a little Vietnam area. There's different areas of Africa. I mean, like
Indonesian
everything
food.
Central, South American. It's so you. That's exactly the right attitude to have. Eating your way through Chicago is exactly the right attitude to have.
Pick the country.
I look
Yeah,
forward to it.
throw a dart at the map. You're approaching it correctly, though. There's
Yeah.
plenty of, and then I'll check in with you in a year, and we'll circle back to the time old question of what's your favorite pizza.
Yeah. Well, I have a
And
lot to try before I make that decision. And
that's
it's
right. So you've got 1 year to get me some answers to that question. So it's looking like 6:03. Maybe we should. You ready to get started, Commissioner?
Yes.
Awesome.
Ready? Okay. Well, good evening, everybody, and welcome to our first town hall meeting. We're going to be having monthly meetings the fourth Wednesday of the month, starting at 6 o'clock. And our next town hall meeting will be February 24th on Wednesday. So put that in your calendar. The global pandemic of COVID-19 has changed the plans and the priorities of the world, minimizing harm and fatalities, developing and distributing a vaccine, and equitable distribution of resources while we shelter in place, and have been great concerns that have changed the way that I'm expected to do my job. So the very beginning of my tenure required a radical rethinking of what it means to serve the people of Cook County. With the help of my remarkable staff, we were able to adapt to these changing times and create a system that continues to provide the service to the residents of Cook County, which they expect and deserve from the commissioners, and also deliver the unique support required by the presence of the pandemic. These town hall meetings are a way to communicate to the citizens of the District 16, to hear your questions and your concerns and give you feedback regarding the district. So now I'd like to introduce my Chief of Staff, Michaela Blaze, who will introduce our guest speaker. Thank you very much.
Thank you, Commissioner. Welcome, everybody. I'm so glad you could join us for our first monthly town hall forum today. I have the pleasure of introducing our featured guest speaker. We're going to try to always have not just bring you county information, but and try to also bring some folks here into your home via Facebook, so you can get information straight from the horse's mouth monthly as well. So our first guest of our first ever town hall is the wonderful Israel Rocha. He's the CEO of Cook County Health. He's going to introduce himself because he's relatively new to the Chicago area. And he's going to provide us with some valuable updates on COVID-19, the vaccination rollout plan. He just joined Cook County Health in October of 2020, and he comes to Chicago by way of New York City. He's served as the CEO of New York City's Health and Hospitals, Elmhurst and Queens Hospital. They had, which is the largest public health system in the United States, and they had a budget of over $8 billion. So he can absolutely 100% handle Cook County's budget of, I'm sorry, Mr. Rocha, did you say it was three point something?
3.6 and growing, so.
$3.6 billion and growing. But he's already done $8 billion, so it's fine. This is not a big deal at all. But Mr. Rocha joins our forum, again, to introduce himself to you all, and then to give some information. And then if you can stick around, there's going to be questions afterwards. Mr. Israel Rocha.
Hi, so I'm very excited to be here. Thank you so much for the invitation, Commissioner Aguilar. I'm very excited to be here today and to meet everybody. Really excited to be here to talk a little bit more about Cook County Health. So we can get started with the presentation. We can go over some of the information, but to everybody and to be with you tonight, just really excited to be here and look forward to getting to know even more of all the different neighborhoods and make Chicago one of America's most exciting places to live and to be at. And that's why I'm really just so excited to be here, because I think that Cook County Health and our health system that we provide, it has a great opportunity for everybody to be able to get care and to really bring to life the idea that healthcare is a human right. And so excited that Cook County puts the resources and investments to bring such a dynamic system to life and to ensure that everybody can receive care in Cook County regardless of their ability to pay. I think that's one of the most exciting things. How we can maintain our life, how we can be healthy, and how we can protect ourselves and our family is one of the most amazing things that we can do. And so whether it's COVID or just every day needing access to a primary care doctor or to a specialist, we're here to help you. And I just want you to hear those words from me, that regardless of what kind of care you need or what question you have, the only thing you need to know going forward is that if you're sick, if you're injured, or just need a checkup, get to Cook County Health and we're going to take care of you. That is our commitment to you, and we're here for you. So on the next slide, it tells you a little bit about our organization, so you can know a little bit about our system. We operate 2 hospitals, which are Strozier Hospital and Providence Hospital. We also operate a series of community health centers, which includes the Borden East Adolescent Health Center at 2423 South Austin Boulevard in Cicero. We're so excited to have these opportunities in places where you can come to access our healthcare services. We also are the healthcare provider for the Correctional Health Services, so we operate all healthcare operations at Cook County Jail. We also take care of all the healthcare operations at the Cook County Juvenile Detention Center. We also operate the Public Health Department for Cook County. So the Cook County Department of Public Health, which has the jurisdiction for suburban Cook County, is operated by the Cook County Health System. And we also have and operate currently a Medicaid managed care plan known as County Care. This is how we can help people get eligible coverage through Medicaid, and we can be able to work with you to make sure that we're providing integrated care services that really bring health care to you and to your family. Today, I'm here to talk a little bit about our community vaccination program. And this is really exciting that we have worked together to create an ability for people to sign up, to get information, and to learn more about the COVID-19 vaccination that is available to you and to your family. So I want to start first by telling everyone this slide that you see before you is a snapshot of our website. It lets you come here and get information. You can sign up. You can have reasons to be vaccinated. You can get the information and facts about COVID, about the Moderna vaccine, about the Pfizer vaccine, about the information that you need. To access this website, you go to vaccine.cookcountyil.gov. This is where you come. This is a site that will welcome you. And that orange button at the bottom, it says click here to sign up. That's where you start your journey. On that click, it tells you how you can sign up. It lets you enter your information. It starts by asking for your zip code. Then you enter some information that we actually need so that we can be able to determine whether you're in 1A, 1B, 1C, or in phase 2. And that tells us the priority which you can get an appointment to get the vaccine. If you're in an eligible group, like 1A or 1B right now, it will then put you into a scheduling screen where you can actually schedule to get your appointment. Unfortunately, we still don't have enough vaccine for everyone to get immunized today. We are working every day to get more vaccination. But our responsibility here at the health system and the county is to make sure that we have lots of places where you can get it when we do get the supply. And to make sure that you don't get an appointment that results in you not getting the vaccine because we ran out, we will only post appointments when we have a guaranteed vaccine product for you to get. That means that while it may be frustrating to see that there are no appointments available, when you do get an appointment, you are committed to ensure that you have the vaccine and that your appointment should not be canceled unless unforeseeable circumstances happen. And that's really our ability to know that when you get that appointment, you have that guarantee that you will get the vaccine, you can come into the different locations, and you can be vaccinated. And so we're really excited. For those that have some challenges and concerns about going online to get this information, we also have created a phone center where you can call, you can sign up, you can get information. And that number is 1-833-308-1988. Again, that's 1-833-308-1988. And this is how you can be able to register to get more information. You can get access. If you're not eligible for the vaccine, you still can sign up. And what I mean not eligible means your ban has not come yet. You're not a healthcare worker, you're not over the age of 65, and you're not an essential or first responder. Those are the people who can get it now. People over the age of 65, healthcare workers, essential workers, and first responders. Those are the largest amounts of classes. There's a few others, but when you sign up, it will tell you that. If you're in that group, you can get the appointment. But if you're not, you still can go to this site, you sign up, we get your email, we get your information, and the minute that you become eligible to get the vaccine, we notify you to come back to the site and get scheduled. Next slide. When we were creating how we could work to make sure that we were getting vaccine to all the people that needed it, we really thought about the population, the people that want to get this vaccine. And I think of my family. My mother, she wanted to get it immediately. And she called us all. She told us that we needed to get it. And there's a lot of people like that who want to get the vaccine the minute that they can get it. Then we have some people, like some aunts that I have, and they were very concerned about the vaccine. They had questions, they needed information, and they needed more information to talk to their doctors, to talk to a healthcare practitioner, to have that very close relationship to make the decision to be immunized. And so knowing that we have many different groups of people who are going to approach getting vaccinated so differently, we created a series of different types of vaccine points that people can access. One of those is converting our community health centers. These are our clinics, 13 locations, 6 in suburban Cook County, including Cook County Health Morton East Adolescent Center, as well as clinics in the Cicero area, and then also 7 located within Chicago, in the city limits of Chicago. Those clinics are regular clinics. They have more providers, they have doctors, they have nurses. You can sign up, you can get your immunization. It's like coming to the doctor's office. And if you need questions, we have people that can help answer any questions that you may have. But we also knew that there was going to be a lot of people. The minute that we moved from 1A to 1B, there was close to almost 1 million people who wanted to get vaccinated immediately. And that meant that just having clinics or small offices wasn't going to be sufficient to get people as quickly as they wanted. So we created larger and mid-sized vaccination sites. Most recently, you saw one of those sites come open. That was the site at Tinley Park Convention Center. Those are large sites. We can immunize north of almost 3,000 a day when we have sufficient vaccine. We can get people in quickly, we can get people in safely, we can take care of social distancing, and we can do everything we can to make sure that we're getting the most amount of people through. Then there are some communities that are going to need even more information, and they're going to need a special dedicated team, a mobile unit, to go out and work with places like the Cook County Board districts, prioritized on COVID cases or economic indicators, areas that were really hit hard by the COVID vaccine that we need to make special outreach to and create special response teams to make sure that they're there, that they can come out, that they can speak different languages, that they're available to talk to the community and provide the information that they need. And so those are mobile units that will go out. We also are going to have strike teams that will be operated. These are for individuals who sometimes have transportation challenges or who can't get to clinics on their own. They're homeless shelters, homebound populations like our seniors, our grandmas, our abuelos y abuelas who need more help to come out and get immunized. We're going to have strike teams that can work with them. We're also going to have workers who, because of their work and that they work on odd hours or they work late hours or they work during the day and they can't take time off from work to go get immunized, we're going to create special opportunities for them to work on their schedule, on their terms, to still be able to get vaccinated and not let their work hours prevent them from coming. And lastly, there's hard to reach populations. These are citizens or residents who really just are hard to reach. They don't listen to the news, they're not engaged, then they need more attention to go out to them. We are going to do everything possible to go out and reach those populations. And hopefully, when the weather gets a little bit warmer and we have more people available to us, we are going to use places like the Forest Preserve District. And that's going to let us be able to use outdoor venues to have drive-up locations or even possible drive-through vaccination locations to work together on creating these sites. And so we're really excited about creating these opportunities and working with you that also are reflective of the many different ways that people want to get their vaccine. Next slide. And we're not just stopping there. We're going to go forward. So we're not only just working on ensuring that we have opportunities with those sites, we've also partnered to create a lot of smaller sites. We are participating at Cook County with a federal pharmacy program. This is helping and having a partnership with CVS and Walgreens. They will be very close to your locations. They will have vaccine directly available, and they will be our partners in vaccinating long-term care facilities where some of our seniors reside. And we will make sure that that access is available. We also are working with hospitals to make sure that if you work with hospitals, to work with their EMTs, their paramedics, their personnel, to make sure that they have available vaccine. Places like Loyola and Advocate are vaccinating 1A and beyond from the community at their clinics so that patients who see them also have the opportunity to get the vaccine at their locations. We're partnering with pharmacies like Jewel Osco, Walgreens, Mariano's, and providing vaccines for 1A and beyond at these select sites so that they also can be available to give you vaccine. And we're also working with our federally qualified health centers, our FQHCs, like Oak Street Health, who are working and have already relationships with patients and giving them vaccines so that they can give their impaneled patients when they come to the doctor the vaccine. And then lastly, we're going to work with schools and EMS and fire departments to have hyper local sites, small sites where we can work with frontline essential workers at the local level to make sure that every community has some kind of place that they can come to get the vaccine. And so you can see from large sites to medium sites to working with community colleges, clinics, districts, supermarkets, pharmacies, hospitals. We're working across the spectrum and around the map. This slide shows you every inch and every area of Cook County has a point where you can come and get your vaccine. But honestly, this all starts with you. We can create the centers, we can create the access, but we need to make sure that you have the information that you need to feel safe to come get the vaccine. And that's what today is. It's a part of that conversation so that we can make sure that people feel safe, that they understand what is going to be provided to them and their family, and that they have those location sites. And we're committed to being your partner in that process. Next slide. Just to make sure and review, we get a lot of questions about what phase am I? When am I going to be able to get the vaccine? Who's in this vaccine? And how many people are in the vaccine? So you can see in this chart in blue, you can see the larger the group, the more people are in that group. Right now, phase 1A are eligible to get the vaccine. That is healthcare personnel and long-term care facility residents. Phase 1B is also currently eligible to get the vaccine. Those are frontline essential workers and individuals over the age of 65. As we work through these two groups, there are two other groups that still will need to get the vaccine, and they will become eligible as we work through the first two groups and we give them the vaccine. Those first two groups were selected because they are the individuals that help provide the vaccine, and they're also the individuals at greatest risk for complications from COVID. The next two groups that will be coming up is phase 1C. Those are persons aged 16 to 64 years with high-risk medical conditions and essential workers not recommended for vaccine in phase 1B. In phase 2, that is every individual over the age of 16 not previously recommended for the vaccine. So by the time we get to phase 2, it's pretty much everyone over the age of 16. These are the groups that we'll be working through. This is why we've created a large network of availability of vaccine, and we will continue to partner with you because at Cook County Health, we make one commitment. We will work with you, and we ask you to be patient, but we promise that everyone who wants a vaccine will get one, and we will work with you until that happens. Next slide. So I want to thank you so much for giving me this opportunity to come into your home, to get to know you. I can't wait until COVID is behind us and I can meet more of you in person and come to the district and to come to the communities and visit with Commissioner Aguilar to see your communities that are so exciting and dynamic that make Cook County and Chicago so special. And so thank you so much for giving me this opportunity. We promise at Cook County Health to be your healthcare partner, to help you get vaccinated, and to help be a partner in building a stronger, healthier life for you and your family.
Mr. Rocha, that was an awesome presentation. Thank you so much. There's so much information there. But first, I want to send quick shout outs to the mayor of Hillside. Mayor Tamburino is watching. And also Mayor Katrina Thompson from Broadview.
Hello, Mayor.
Hey, Mayor.
Broadview, Hillside.
And also we've got the Veterans Assistance Commission of Cook County. They're chiming in, which is so wonderful. Jose Marquez is also saying great, beautiful, wonderful job. Inez Murillo is concerned that we didn't have Spanish on a Spanish translation for this version of this conversation. I promise you, Inez, all of the materials on our website are both in Spanish and English. Just in for the sake of time, and also because I didn't get a translator Our translator canceled at the last minute, and so we're kind of rolling through this. But there is another event coming up in a couple of weeks that's even more comprehensive. It's through President Preckwinkle's office, and it will be completely in Spanish. And so we want to make sure that people are referred over to that. Sorry, Commissioner, did you want to add something?
No, I was going to mention one in Spanish. Thank you for mentioning it.
Is that great? Okay. So I just want to say hello to everybody. And I think we have a few questions. Is Tanisha going to jump in and give us some of the questions? This is our wonderful and spectacular digital, our comms director, actually our communications director, Tanisha Woodson Shelby, that hails from the western suburbs, born and raised. And so she's going to share with us some questions that we received, both online and because we sent a survey out before this actual event, and some people sent questions in. So Tanisha, take it away.
Okay, so the first question, excuse me, came from one of our that was submitted. It goes, I work for a food delivery service. Would I be considered an essential worker?
So yes, you would be considered an essential worker in food and grocery under the 1B classification. So we would just ask that you sign up and that you give that information. And on the beautiful part of the website is that when you design it, you enter the information, you get to answer some questions, and it helps tell you what band that you're in. So I would really encourage you to come out and sign up on the website, and let's get you vaccinated.
Okay. Another question is, when should 1B and 1C anticipate receiving the appointment?
So again, the appointments are really are based upon how much vaccine that we get, and so we are going to keep a moving announcement. So every time we get more vaccine, we post that number of appointments, and then we email everyone and say the site now has appointments, so that you can come in and you can sign up. That's why we ask you to sign up. We'll give you the information. And we're really hoping that, we are trusting the announcement that was made by President Biden that his mission is to give 100 million immunizations in the next 100 days. And we hope that he will be successful in negotiating more vaccine to our community. But right now, what we can do is be ready to have everyone signed up on the website to make sure we have the ability to give the vaccine, and hope that we continue to get a greater supply of that vaccine. But we're confident that every week we're going to keep building some appointment availability for everyone to come to. So please stay vigilant, be patient, work with us, and I promise that we're going to get to you.
Okay.
Hey, Tanisha, real quick, I want to also send a shout out to Village Clerk Laura Cassidy Hatchett, who's tuning in today. And she said the words we all love to hear. Please let us know how we can help. Thank you so much, Laura. I'm sure we'll be reaching out. And real quick, for you, Mr. Rocha, we're getting so many offers of help like this, like, hey, you can use my school. Hey, you can use our parking lot if you need to do drive-through testing and so forth. How do we communicate that to your office? And if people have those kinds of offers, should they send them to us, or do you have a hotline for that kind of outreach?
So we have a few ways. One, they can definitely send them to you, and please give them to us, and we can work together as partners. So please give us that information, and we'll continue to work forward. If someone wants to learn more information about how they can become a partner in helping through the vaccine program, our public health department on their website has a link where you can sign up for partnerships. And the state also has a website where if you're interested in becoming a partner in distributing the vaccine, you can sign up with them as well. And so if they start with you to give you the information, we'll get them to the appropriate place. We'll give you some links that maybe you can put on your website for people to come back and have information. And that way we can help everyone get the information that they need and direct it to where they need to go to help in this effort.
Great. Do we have more questions, Tanisha?
We do. The next question is, I live in the west suburbs. Where do I go to find a vaccination site?
So the exciting part again is that we would tell you, you can come to our website. On our website, we have all the locations that you can go to be able to qualify and get to get set up, to find out your ban, to find out if you're eligible, and then if you are eligible, to get a vaccine site that is for you and your family with an appointment. And so we're asking everyone to go there. If you want to know, that's how you can make sure that you get your appointments, that you get your information. That has the whole county. And I think it's important that everyone knows that, at least from Cook County Health and the city of Chicago, we've made this as easy as possible for residents. We're saying that if you live in the suburban part of Cook County, where you're within the jurisdiction of our public health district, or you're in the city of Chicago, people are able to get vaccinated at both, and we work with both communities interchangeably. So all they have to know is go to a site. And so if you go to our website, you will find out our sites, and you'll also find all of our partner sites, and we can help get you that information.
Excellent.
That's great. One more shout out, Tanny. I want to get one more shout out in our wonderful, one of our first partners when we moved into our new office. I don't even think we had an office yet. And Marian Pabellon was like right there from Paso. She was offering her assistance and helping us to, right? Helping us to get acclimated, and so she's online too. And I just want to say big shout out, Ray Nonato, one of our Northwest Side partners, who is really helping us. He's doing a bunch of free COVID-19 testing throughout the western suburbs. And all of that information, again, if you're watching this and you want more information, please like our page, follow our posts, sign up for our email list. All of this information we send to people probably more than they even want it. But we are here to communicate. We are here to share information, and we want to stay in touch with you. So please feel free to share your information with us. Additionally, please don't forget that number. I think I want to just underscore what Mr. Rocha said. You can call that number, or you can go to that website and put in your information. And then as soon as your number pops up, they'll get you scheduled for an appointment. So it's a great resource. Please use it. Please get on the list so that we can get you vaccinated as soon as possible. Thanks, Tanisha.
Yeah, and I think that wrapped it up on our questions. Let me just take another little perusal here just to make sure I got everyone. Yes, that wraps up our questions.
That's all I have too online. But we're not going anywhere. So I want everyone to know, if you're watching this, what usually happens is we record these things, and 50 or 75 people pay attention that night, and then by a week later we've got 1,000, 2,000 views. So if you're watching this later and you need additional information, we're still watching the chat. I'll make sure that we include our information for you to register for your vaccination, and information for you to contact our office into the chat. And we're not far away. So with that, we can wrap things up. Unless, Mr. Rocha, is there any parting thoughts you'd like to share?
No, just that I'm really excited to be here. Y para la gente que habla en español, vamos a estar con ustedes en 2 semanas. Es un placer conocerlos. Y tengo el gusto en unas cuantas semanas, cuando ya COVID se ha pasado, a saber más su comunidad y poder partir en sus restaurantes y comer juntos, y para gozar la vida otra vez cuando COVID ya está detrás de nosotros. So, por favor, agarren la información que necesitan para poder agarrar la vacuna para su familia, y la información que necesitan para poder hacer esa decisión en una manera que están muy orgullosos para poder agarrar la vacuna. Si tienen preguntas, si tienen dudas, que necesitan ayuda, por favor, contáctalos a Cook County Health. Estamos ahí para apoyarlos. Muchas gracias.
And Commissioner, do you want to close this out for the evening?
Muy bien, thank you, Mr. Rocha. Y en español, como dijo el señor Rocha, va a haber otro foro completamente en español con la oficina de la presidenta Tony Propico, mis colegas de commissioners de Cook County y en un par de semanas. Okay, gracias, señor Rocha. I just want to say one thing. Mr. Rocha's time, 24/7. I know we talked at what was it, midnight, 1 o'clock in the morning on Monday. So it just shows his commitment to the people of Cook County, and I would really appreciate you, Mr. Rocha. I mean, it shows how dedicated you are to the residents and of the people of Cook County. So again, I enjoyed working with you, and we're gonna beat this virus sooner or later. So again, thank you for being here. Michaela and my staff, thank you very much. They're super. Tanisha, Gillian, and where's Cecilia? Cecilia, thank you again. Thank you again to everybody for joining us. Uh, um, be sure to every Monday, every Wednesday, the fourth Wednesday of the month at 6 o'clock, we will have a Facebook Live again on information, and the next one will be February 24th at 6 o'clock. And again, thank you. You can call my office at 312-603-4735 or log on to commissionerfrankaguilar.com. Thank you. Muchas gracias. Buenas noches and good night.
Thank you, Commissioner.
Thank you, Mr. Rocha. Thank you.